think we can start. Good afternoon, everyone, and welcome to this presentation on health pathways. We have designed today's presentation mainly for practice managers. My name is Sherry Lynn Garner, and I am the Program Specialist for Health Pathways Melbourne. First, I'd like to do an acknowledgement of country. Eastern Melbourne PHN acknowledges the Wurundjeri people and other people of the Kulin Nations on whose unceded land our work in the community takes place. MFIN respectfully acknowledges their ancestors and elders, past, present, and emerging. Just a bit of housekeeping. So all attendees are currently muted. Please could we ask you to put your questions in the Q&A and we'll get to the Q&A at the end of the presentation. Your questions will be anonymous to protect your privacy. And just a reminder as well that this session is being recorded. And if you haven't already, could you please ensure you join the session using the name you registered with so that we can then mark your attendance against your registration. So today we will go through the benefits of using health pathways, how to use health pathways, and how to find new and important changes. We'll go through some hot topics or pathways of interest. And finally, I'll show you how to access Health Pathways Melbourne. So Health Pathways Melbourne is an online resource that provides general practice teams with evidence-based advice on how to assess and manage a range of conditions, as well as guidance on local referral options. It does not replace textbooks or any clinical guidelines. Rather, what we do is we translate evidence and best practice advice into practical advice that can then be used at the point of care. The content on health pathways includes clinical pathways, referral pathways, and resource pages. The process of developing content is a collaborative effort between our local GPs, local specialists, allied health providers, and other subject matter experts. So why is Health Pathways a valuable tool for general practice? Firstly, Health Pathways is written for general practice by local GPs. Our team includes 9 clinical editors who are also GPs in our local area, so across the Eastern Melbourne and Northwestern Melbourne PHN catchment, and they review and write the content on the website. So really, when they're writing content, they approach it from their perspective as a local GP and with general practice in mind. The question they would normally ask themselves is what it is that we need to know in general practice, or how is this information useful for general practice. So we really write it with the GP or general practice teams as audience in mind. Health Pathways makes many valuable sources of information accessible from one place. In general practice, I know you receive so much information from so many channels and sources. So you've got your patient emails, newsletters from all different sorts, NPS. You've got websites you've bookmarked for health services, community health, Department of Health. So it's not unusual for you to have so many shortcuts on your desktop and so many pages bookmarked on your browser, along probably with a pile of handouts and flyers on your desk as well. So what we do is we synthesize what information is relevant for general practice, and we link out to hospital websites and department health websites, AMH, ICGP, and many other sources. So in that way, Health Pathways actually serves as a one-stop shop for you or for general practice. And in a way, it's a gateway to then for you to access a range of clinical and patient resources. Another reason why Health Pathways is valuable to general practice is that it complements education and training events. So unlike a PDF or a handout, it is a dynamic platform that we update regularly. A handout could easily be misplaced, or it could get lost in a pile of paper, or you forget where you've downloaded and saved a file. The alternative to that is really to just jump on Health Pathways Melbourne and look for that information. As I have mentioned, Health Pathways is written for general practice, but it's not just for GPs. It is for practice managers and practice nurses as well. For practice managers, you can access advice on infection control, MBS items. You can access a whole range of information and forms for the multi-purpose taxi program, accessibility parking. There's information on certification of death, a range of action plans, and many, many more. For practice nurses, we have a suite of pathways on immunization, but there's also pages on chronic disease management plans and pages on the various health assessments. I'll jump on the live site towards the end of the presentation and show you some of these pages. Next, I want to show you how to find information on the website and how to find new and important changes. So here I'm showing you the homepage, and we have a section there called Latest News. That section pretty much captures the Chief Health Officer's health alerts and health warnings. So we give you a quick summary there, but that link, read more, will take you to the actual Department of Health website. Another area where you can look at updates is on the homepage. Again, we have a section called Pathway Updates. This features the 5 latest pages that have been updated, reviewed, or a partial update, as well as any new pages that have recently been published. So in the last few days, you can see there we have a new page on fatigue and monkeypox. I have heard from some practice managers that they actually use this section of the homepage to inform their practice meetings. So they go through what's been updated in Health Pathways. That way, the entire practice team is aware of changes, and they can jump on these pages and look at what's new to inform their practice. So that might be something you would want to consider to just help your GPs and your team get into the habit of using Health Pathways. If you are after a specific topic or information, there are 2 ways you can find that information. The easiest one is to just use the search box at the top of the page and type in a keyword. But if you are more familiar, or as you become more familiar with the structure, you could also use the table of contents on that left-hand side. There are currently 886 pages on the site. So hopefully, when you search for a topic, you will be able to find it on the website. But if not, because I know we are not, complete 100%, we would want to hear feedback from you on what information you were looking for but couldn't find. So on the bottom right hand of the page, you will see a send feedback button there. So once you are on a page, you might see 2 boxes at the top of the page. So the yellow box is what we call the clinical editor's note, and the pink box is called the COVID note. The clinical editor's note is where we include new or time-limited changes that our clinical editor thinks are important to flag. We also use this to share important updates. Oftentimes, you get updates the same time as you do the night before, and it's something that's being implemented the following morning. So we might quickly put up a link, an announcement via that clinical editor's note, and we then spend a bit more time to actually update the page content with those important information. So the example on the screen, as you can see, we put up a clinical editor's note when the new model for COVID pathways was released, and we have in there the last dot point. It says just to advise GPs that from 1st of October, there will be further changes to that model. And then we put up a note about monkeypox on our HIV page. And that pink note there is a COVID note, which functions in a similar way, except this is specific to how COVID has impacted clinical care for that topic. So in this instance, in the area of HIV, this COVID note is advising that the GPs could consider Evusheld, and they can now prescribe Evusheld to their patients. Oops. Sorry. So Health Pathways Melbourne has a 3-year review cycle. So every 3 years, we will do a full review of the suite. But outside of those 3 years, we also do lots of partial updates. In the last couple of years, those partial updates have been as frequent as 2 to 3 times a week. So, for example, you may find out that criteria for a COVID medication has been updated yet again. But you want to know what is the latest update and how is it different from the update from 2 weeks ago. This is where the new and important changes drop-down box can be useful. So that's circled on the screen right there. Not all pages have this function. It's only for those that are currently frequently getting updated. When you open this drop-down box, you will see what the update is and what the update and when the update was done. So it will feature usually the top 3 or 4 updates for that page. The other section where you can find a full list of updates pertaining to COVID is the COVID-19 recent changes. And you can find that page on the table of contents on the left-hand side. If you open the main section COVID-19, the first page you will see there is the COVID-19 recent changes. Now I want to spend some time showing you some pages that may be of particular interest. The first one is the medications in COVID-19. This will be more relevant to GPs, but please let your GPs know that on this page are links to tools to check interactions, links to prescribing guides, how to find pharmacies where you can access certain medications, guidance on eligibility, where or who to call for prescribing advice. So that's one page that's probably getting a lot of views right now. Another page, which I mentioned we just published last week, is monkeypox. So on this page, you can find information on how to assess for monkeypox, infection control, guidance around privacy and reducing stigma, the eligibility for the vaccine and the limited clinics currently available in Metro Melbourne that offer the vaccination, and what numbers to call for clinical advice. The next one is the COVID-19 practice management page. This page also, you will see, has the what's changed drop-down box at the top. The information on this page includes advice on managing vulnerable patients. There's a section on coordination, which includes information on preparing a COVID-safe plan for your practice. It also includes a link to the emergency response planning tool. It gives you advice on how to set up your practice to be COVID-safe. And other information also includes infection control, so things to consider around ventilation, patient screening, and patient access, cleaning the practice, physical setup, clinical care considerations. And other headings there you will see, we also have information on PPE and responding to a positive case in the clinic. Another popular resource page is our guide to MBS items, which lists MBS items frequently used in general practice, including those relating to COVID-19. So there is information on eligibility, especially for the telehealth items. And you will see that this page lists the service on the first column, then or the item name. Then on the second column, you might have the item number. It features the rebate amount and other important notes relating to that MBS item. Another important information in Health Pathways not related to COVID this time is the statewide referral criteria. So there are statewide referral criteria for various conditions, and health services across Victoria are triaging patients or referrals against this criteria. So on Health Pathways referral pages where statewide referral criteria exists for a condition, on the referral page, you will see a section check statewide referral criteria, as you can see on the screen. This opens a drop-down box that then lists the different conditions. And in there, you will see a list of the inclusion criteria, exclusion criteria, along with information that's required prior to sending the referral, without which your referral will actually be declined by the health service. On the left-hand side, just want to show or mention that these are the list of conditions that currently have statewide referral criteria. So all the referral pages referring to cardiology, chronic pain, and everything on that list will have statewide referral criteria information on them. So for referral information more generally, we have acute and non-acute referral pages that include information on where you can refer and how. On a typical referral page, we have a private section where we include links to directories to find private providers. Then there is a public section listing public hospitals and community health services. The services are organized by catchment. So you can select your relevant catchment to see the list of services. This then opens a service, the list, and you can then select a service to see further information. So here, for example, I've opened the Eastern Health Gastroenterology Clinic, and it shows you how the service wants to receive your referral. So as you probably know, Eastern Health is only receiving referrals via electronic referrals now, but there's also a phone number you can call should you need advice about your referral. And on the right side would be criteria, so information on patients they see and patients that they don't see. Next, I want to show you some of the forms and resources, but for this one, I want to switch to the live site. So this is now, I'm on the actual HealthPathways Melbourne website. And most of the resources sit in this section here under our health system. So click on this arrow here to open that list. And in there, you will see forms and resources and MBS items. I will just open MBS items here. And we talked about guide to MBS items quickly, which is this page. So you can open any of these drop-down boxes to look through specific items. There is a chronic disease management items page. And that's just a snapshot of what that page looks like. There is a range of health assessment pages. So I've gone to health assessments on the table of contents, and you will see the full list of health assessments in that section. So you have your 45 to 49-year-old check. You have 75 plus assessment, assessment for Aboriginal and Torres Strait Islander people, for people with intellectual disability, etc. So I'll show you one of them, 45 to 49-year-old check. So this might be more probably for the practice nurses and the GPs to look at. If I scroll back up, I'll just show you forms and resources. So here is where you might find other useful pages. So accessible parking permits, for example. So this goes through how to apply, renew, or replace a permit. And you can see we link out to the actual online form for these as well. So you don't have to go looking for the website in your browser. You can just access that via HealthPathways Melbourne. Then I'm clicking on action plans, and this has a list of different action plans for asthma. We have a COVID treatment plan in there, something for COPD, etc. So if there was an action plan you think you use a lot or need, but it's not on the list, please let us know and we can add that on the page. We have a page on certification of death. So I didn't talk about the drop-down boxes, but these arrows here, they open to much more information. So you could be skimming through the page, and then if you just want a bit more information about issuing a medical certificate, for example, you can click on the box and that gives you a bit more information. Another page just to show you, we have a multi-purpose taxi program page where we have eligibility requirements in there and instructions on how to complete and submit the online form. There's also telehealth, which you probably may be already familiar with in terms of setup, how to conduct a consultation, and there's other resources in there. I'll do a search to show you Fitness to Drive, which I think is of interest as well. So this is just to show you the search function too. So Fitness to Drive, again, it goes through assessment, and this one covers guidance for different topics all in the one page. And related to driving is, so I'll do a search for drive. And you will see here, there is a OT driver assessment page. So I might switch back to my slides now. And if you have questions with what you've seen so far, please let me know and pop them in the Q&A section. Oops. So for you to be able to access all these wonderful resources, I need to show you how to actually get on Health Pathways Melbourne. If you don't have access yet, when you go to the, oh, I didn't put the link. I'll put that in the email. I'll give you the link to melbourne.healthpathways.org.au. And when you get on the site, there is the register now section, which you can use. But if you don't have access yet, we actually have issued, or we have unique URLs or links for every practice in the catchment. And with this unique link assigned to your practice, you can actually gain automatic access. So you bypass the login page completely. So what we're doing is, for all the practices that have registered to attend today's session, in the next couple of days, we will send you your unique link, and we will include in that email instructions on how to bookmark that link for each of your desktops in the clinic. Finally, just want to mention that we do welcome your feedback, good, bad, any feedback. If there is something you did not find on Health Pathways, please let us know and we can consider it for our work plan. And to send feedback, on every page, there is that send feedback button on the bottom right corner. When you click on that, you will see this online form. And if you're on Health Pathways now, please feel free to click on that now and maybe send me a feedback on what you have found most useful on Health Pathways based on today's presentation. Okay, I might jump onto the Q&A and see what questions we have. Are all Centrelink forms included or just selected ones only? That might be too broad. I wonder if you can specify which Centrelink forms you might be referring to, if you want to put that in the Q&A section. But I guess I can say it's not all Centrelink forms. If there are ones that are used most often in general practice, we can certainly consider that. That one that's been posted, SU415, it doesn't sound familiar, but we can look into that for you. I'll definitely have a look at the Centrelink medical certificate. Off the top of my head, it doesn't sound familiar, but I will have a look. And then maybe I can get back to you directly on that question. Okay, a few more. Thank you. Noted about Centrelink forms. We will definitely look into that. I am not seeing any more questions come through. Seeing we have I think about 5 more minutes, I might just show you one referral page and then we can probably bring the presentation to a close. So I'll just go through gastroenterology referrals. So referral pages in Health Pathways, there's two types. There's, for the main part, acute and non-acute. So this is the non-acute referral page, and we were talking about the private section. If I open that link that says refer to the service, there's a link to the NHSD, but also link to private hospitals that do have a gastro clinic. If you go into the public hospitals, we talked about statewide referral criteria. So this one does have statewide referral criteria, and each of these conditions have their criteria. And if you open that, you will see inclusion and the required information to include in the referral. Other than the statewide referral criteria, if you do need to contact the GPLO, we have a linked or a page that lists the hospital general practice liaison officer phone numbers in there as well as the Aboriginal Hospital liaison officer numbers. So let's say we are in, obviously, the MFIN catchment. So I want to refer to Austin Health Gastroenterology Clinic. So Austin Health is also accepting e-referrals, but they are still taking fax referrals as well. And this pre-referral link just takes you to the Austin Health website, where they have further details on referral guidelines. And in every service, we do list the head of unit, so that if the referral needs a name specialist, you can just pop the name of the head of unit in that referral as well. I think that is all I wanted to show you outside of the other pages. So if there are no more questions, just want to remind you that a survey will pop up as soon as the webinar ends. Could we please request you to complete the survey? I think there are about 5 questions only, so that shouldn't take long. And just wanted to thank everyone for coming along. If you have any other questions that you think of after the webinar, feel free to contact the team on info@healthpathwaysmelbourne.org.au. Thank you.